Are you sleeping with more than one person and having unprotected sex? If you are, then the chances of you having a sexually transmitted infection are pretty high. Knowing about and treating an STI early on can save you some serious long-term health problems, and just as importantly, it can stop you passing it on to someone else. So not being bothered, just not an excuse. Sexual health centres are often known as GUM clinics, which stands for genito-urinary medicine. They can be found in hospitals or health centres, which means you really don't have to travel that far to get to one. Not only do they offer treatment and tests for STIs, but they also offer advice on contraception, such as the morning after pill and condoms. Most clinics offer walk-in times during the week, but if you're a bit scared about just bowling up, you can speak to your GP or you can call your clinic beforehand to make an appointment. To show you just how easy it is, I'm going to head down to my local GUM clinic now to demonstrate a scenario and show you how to get tested. I'm here to get a sexual health test.
Okay, have you been here before?
No.
This is the first time, yeah?
Yes, yeah. Right, the first thing you've got to do is to fill out this form, and you don't have to put your real name, but that definitely helps. One thing you really have to put down though is a contact number, so that these guys can text you if they've got any results, or they can call you if they've got any problems. Also, explaining why you've come down here helps the team to decide who's best to see you. And don't forget, everything is confidential, even if you're under 16. Right, I'm in the consultation room, so now I'm going to talk to Lee about getting tested.
Okay, so you filled in our triage form and you've indicated that you've got no symptoms and that you're concerned you've had sex with someone who may have an infection.
Yeah.
Yeah?
Yeah, basically.
Okay, have you ever had a sexual health screen before?
No, I haven't.
Yeah, let me just tell you what we're going to do. We ask you some questions about you and your general health, and then some more specific questions about the types of sex you've been having, with who and when. A little bit embarrassing, but please don't worry about them. Okay, do you want to just tell me in your own words kind of what's brought you in today?
Yeah, I started uni last week, went to Freshers Week and managed to have sex with 2 women. So yeah, I've heard from a mate since then that one of them might have an STI, so thought it was best to come down here anyway and just find out, because she might not, but it's probably best to get tested. I can't really see any symptoms at the moment. But
okay, you're mentioning you haven't got any symptoms at all. When we talk about symptoms, what we mean is like a discharge from the penis, which is like a liquid coming out the top, any pain on ejaculation, or burning when you're passing urine, or anything else that's not normal for you.
No, none of that.
And nothing else that's abnormal for you on the skin? Everything's fine as far as you know?
No, pretty shipshape.
Brilliant, okay. So the 2 partners that you mentioned, when did you have sex with them?
Yeah, it was both in the last week. So.
Both within the last week, okay. And what type of sex was it with them?
Just standard stuff, so vaginal, I guess. Yeah.
Okay, any anal sex or oral sex with either of them?
No, no.
And we didn't use condom with them?
No.
And was that just kind of heat of the moment, or do you not like using condoms?
Usually, yeah, it's fine. It's just heat of the moment, yeah.
I know you've never come to a sexual health clinic for testing before, but have you ever been treated for an infection?
No.
No?
No, not at all.
Okay. One of the tests we'll offer you today, Rhys, is an HIV test, okay? Now, from the point of view of the 2 partners that you had a week ago, you're what's called within the HIV window period. Okay, so that means it can take up to 3 months for the virus to show in the blood test from unprotected sex, all right? It's our standard test that we do, so if you didn't want it, you opt out from having it. If you do decide to go ahead and have it, what we recommend for you to do is actually come back and see us in 3 months' time, and we'll repeat that, okay, if you're unduly worried. We're nearly there. Just a few more questions. Okay, we do what's called a mini risk assessment on you, and it's kind of for us to decide whether we need to offer you any other testing based on the questions and the answers you give. Things like hepatitis may be a concern, which isn't one of our standard tests, okay? So, have you ever injected any drugs at all?
No, no.
Or a partner who may have injected that you know of?
No.
Okay, and we're also looking at things like snorting with pipes or tubes or notes for things like cocaine.
No.
The only reason we ask that is for the hepatitis C risk. You can get small particles of blood, so it'd be a risk for there. And have you had sex with another male partner?
No.
Okay. Okay, Rhys, so what we're going to do next is we're going to get you to do a urine sample. Okay, that will test for the gonorrhea and the chlamydia. Okay, and we're going to take some blood tests from your arm for HIV and for syphilis. Do you have any kind of questions or worries before we continue?
Is this going to be like a physical examination, or are you going to stick something down there, or?
Okay, no, we're not going to kind of do any swabs from your penis today. Because you don't have any of the symptoms at all, okay, the urine test is perfectly adequate, all right? If you did come to clinic with some discharge, we would have to take a small swab from inside, but it's nothing like the umbrella stories that you may have heard from years ago, okay? If there's no other questions, we'll kind of get on and do.
Right, I've opted for the HIV test as I'm here, I might as well. So Lee's just going to take a quick sample. Just so we can test for chlamydia and gonorrhea, I've just got to pee in this pot, so I'll be back in a minute.
Okay, Rhys, we're almost finished. You've now had your bloods done, okay? You've done your urine test.
Yeah.
All that's left is to complete your text card, so you actually get your results via text message. All right, so what we do is we pop your clinic number on there, and I'm going to ask you just to pop your telephone number on the bottom. So it's your mobile telephone number.
Yeah.
Yep. Okay. Now, you'll get your text in a week to 10 days' time. It will either say to you that all your results are negative, so just to kind of recap, that's your HIV, syphilis, chlamydia and gonorrhea. Negative means all okay. Or it'll ask you to contact the clinic, okay? Remember to quote that clinic number and we can let you know what the problem is, okay? Remember, you're gonna come back and see us in kind of 3 months' time to repeat your HIV test if you're worried, all right? And do you need any condoms while you're here?
Yeah, sure, I think I better take them, to be honest. So there you go. It might be a bit embarrassing being asked questions about your sex life, but getting tested isn't actually that painful or inconvenient. It's actually pretty straightforward. Most STIs don't even have symptoms, so the only way you're going to know if you're in the clear is by getting tested.